Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm Jay Fidell.
And I'm Donna Blanchard.
In our show this time, we'll cover the remarks made by Rachel Wong at last week's meeting of the Harvard Club.
Rachel Wong is the newly appointed and very well qualified director of the State Department of Human Services.
The Harvard Club of Hawaii meets for a brown bag lunch every month at the offices of Architects Hawaii in Pacific Guardian Tower, through the courtesy of Harvard Club member David Miller.
These meetings are convened by Archie Kale, longtime vice president of activities of the Harvard Club. Rachel Wong spoke at the July meeting of the club. Lots of club members and visitors turned out to hear her there.
Prior to her appointment at the Department of Human Services, Rachel was vice president and chief operating officer of the Healthcare Association of Hawaii, where she worked with healthcare providers on providing quality care and in improving community health.
She also served as executive director of Kokua Mau, that is the Hawaii Hospice and Palliative Care Organization, and the Hawaii Consortium for Integrative Care.
Rachel earned a bachelor's degree in East Asian Studies from Princeton University, a master's degree in public health from UH Manoa, and a doctorate in public health from the University of North Carolina at Chapel Hill. She serves on the National Governors Association Human Services Corps Advisors Network. She is also in the Omidyar Fellows Program.
We got to know Rachel shortly after her appointment when she appeared on our Healthcare in Hawaii talk show with ThinkTech host Josh Green, a member of the State Senate and then chair of the Senate Health Committee.
But tell us a little bit about yourself, professionally and personally, so people can get to know you.
Sure. No, I appreciate this opportunity. Thank you.
Sure.
I'm born and raised here.
Great.
5th generation Chinese, which means I had to go to college to try to learn to speak Chinese.
Oh my God.
Came back and have been here ever since. And my background's a little different than most others. We all have our own personal stories.
Sure.
But mine, when you asked about career-wise, I feel like it didn't start till maybe 2004. And the reason is that, you know, I was sick for a long time.
Okay.
So going off to school, you know, was diagnosed with a chronic autoimmune condition, lupus, and slowly lost kidney function. So I have had these wonderful opportunities where I've had great education, great life, come back to Hawaii, but I've had the patient perspective.
My grandmother had lupus too.
she?
Yeah.
Wow.
So you had lupus, and I've heard, you know, from you over the years about your story, and you're a big advocate for the Kidney Foundation type organizations, for organ donation. Tell us a little bit about that, because I think it's nice for people to know that you've seen it from the other side. You're now in this position where, and we'll get into this, but thousands of employees that are working with you at the Department of Human Services on health matters and, you know, survivable matters here in our state, but you actually were a patient. What was it like?
Well, and continue to be a patient.
Yes.
I think we all are, right? I mean, you know, even you as a doc, right?
Yes.
You still have to go in and get checked up. You do,
I
right?
never get checked up, but I've had kidney stones twice, which was horrible. Yes.
Okay, so we're all patients at some point.
Yes.
And it really shows the interconnectivity that we have with our healthcare system, and more broadly than that, our larger system of services, you know, that provide, you know, whether it's assistance or healthcare or benefits to any of us.
Right.
So I think that's why I'm here.
Yeah.
You know, it's my work having, you know, I've worked at the Healthcare Association of Hawaii the 3 years prior.
Yes.
But before that, it was really with nonprofits in the community.
Right.
So my background is in public health. It's really been moving pieces in the community to affect policy change and to improve quality of life for others.
So this is a pretty extraordinary moment. You were nominated recently, a week or two ago, 3 weeks now? How long has it been?
I started a board almost 4 weeks ago. I stopped counting the days.
Yeah.
For a while I was counting the days, but no, I'm fully in, and I'm fully invested, and I'm very affirmed.
My gosh. See, so for our viewers, we in the state have the Department of Health and the Department of Human Services. And many people are familiar with the Department of Health, and they think that that covers our hospitals and all of our health programs and so on. But I don't think what they're aware of is that the Department of Human Services provides an extraordinary amount of the health care for our state. I want to start back a little bit, though. You kind of had this professional period in the Healthcare Association. You were very impressive there. What kind of things did you work on at the Healthcare Association so people get an idea?
Sure, and at the Healthcare Association, HAH, you know, was the organization that represents the hospitals, the nursing facilities, the home health agencies, hospices, and durable medical equipment suppliers.
Right.
And I worked real closely with all of our members, particularly those that were post-acute, so not the hospital members, but those in the community, right? And really to make sure that, that policy was set where quality care can be delivered.
Right.
Where rates are set, where quality care can be delivered. But most importantly, with the community health needs assessment that hospitals do.
Right. In fact, we've made reference on many occasions to the community health needs assessment here on this show. And to refresh people's memory, this was a very large project that really kind of painted the picture of where we do well and where we can do better in the state of Hawaii. What came of that? What were some of the big findings? Remind people.
Well, just as some background, it's a new requirement under the Affordable Care Act for hospitals,
Right.
for nonprofit hospitals to follow. And it's for them to assess their community, to look at the different indicators there, how well in a community, however they define it, is doing, let's say, with diabetes or with education or transportation, so much more broadly than hospitals have thought of in the past. And to develop plans to improve those indicators over the next 3 years. And they had to attach this to their IRS 990 form.
Okay.
So it's a requirement every 3 years in perpetuity.
Wow.
So it's death, taxes, and community health needs assessments, right?
For sure.
Yeah.
That really, I think, sets you up very well. I hadn't been thinking in those terms before we were speaking today, but now that I think about it that way, that was an incredibly effective primer for you as you were going. I don't think we had this plan necessarily in place, but as you enter into the Department of Human Services executive position, that really, it's shown you the landscape. Do you feel comfortable as you, with this gigantic department, you had maybe you were working with 20 people or something over at Healthcare Association, and now you're working with, how many?
2,300 about.
2,300.
Yeah, it's a lot of people, yeah.
Is that it's got to be one of the largest departments in our state.
It is. It's the largest, I think it's the largest budget-wise, and we're in the top maybe 3 or 4 employee staff size-wise.
Amazing.
But so you asked this question, was it a good primer?
Yes.
I think working with HAH and doing the community health needs assessment gave me a broad perspective of what's going on throughout our islands, right, and in different geographic areas, and also got me immersed in the healthcare system. Yeah. When I say healthcare system, I mean the delivery model. When I've entered DHS, as we call it, or the department, I realized how little I actually knew. And I'm still getting immersed, right? There's so many good people. When we talk about those 2,300 people, so many good people who are doing incredible work and with very limited resources. Yeah. Right? So what the things that we provide in DHS, when we think of healthcare in the interface, naturally there's the Medicaid department. So that's our MedQuest division. Okay. Right? This is providing insurance for people who are maybe blind, disabled, who are older, who are needy, right? So those who are living in socioeconomic strata, so
near poverty at the very least. And we've talked a lot about that on our program over the years. That's a large number now. It's 360,000.
I think we're 313,000.
Okay,
which is a huge increase.
It's a giant number of people, and that's in a relatively small state. I mean, we're talking again about maybe 1.3, 1.4 million people in our state. So almost 1 in 4 people rely on the services in your department to get some of their health care.
Yeah.
At the Harvard Club meeting, we learned that Rachel has assembled a yellow brick road of human service acronyms. TANF, for example, stands for Temporary Assistance for Needy Families. She spoke to us about these things and about homelessness and other community health and human services issues facing our state. She helped us understand where she fits in the social safety net and in that part of state government.
But SNAP and TANF and QI, oh my. Does anybody know any of these acronyms? This is actually an old mission that we're working to revamp, but it captures a lot of the activities that we do. And the goals are to provide timely, efficient, and effective programs, services, and benefits to empower those who are most vulnerable in our state, to expand their capacity for self-sufficiency, self-determination, independence, healthy choices, quality of life, and personal dignity. With all due respect to other nonprofits and other government agencies, I feel like I hit the biggest nonprofit in the state. I mean, people who come to DHS are here because they believe in the mission, right? They believe in if we can get one more child out of an unsafe situation, we can cover one more person. Our annual budget is 1/4 of the state government. I didn't know that until after I came aboard and read it in the paper. $2.6 billion, and a lot of it is the public assistance. We have 4 divisions, which I'll go over, 2 attached agencies and 2 commissions that are attached to us. So our biggest division, it's called BESD, and it's our Benefits, Employment, and Support Services Division. And this is what we think of when we hear SNAP, TANF. So SNAP is what we think of as what used to be food stamps. So it's our supplemental nutrition assistance program. So EBT cards. So it's really providing benefits to folks who are hungry and have kids who are hungry, and to be able to use this at farmers markets and stores to get food on the table and other types of assistance. Medicaid is the public federal program for people who are lower income, and also for people who are aged, blind, and disabled. And it's something that's administered here in Hawaii. And so this is our biggest program finance-wise. It's a $2 billion program. And we provide medical assistance, so insurance, access to healthcare and healthcare services for people who need it. Our social services division is what many people think of as human services. So child welfare services, adult protective services. So nurturing families, strengthening families. So kids who are in unsafe places, whether it's through abuse, neglect, it's providing services at home or getting them to safe places. Adult protective services are for adults who are vulnerable. So you might think about folks you might know in the community. Financial exploitation is something big that we're facing. And something I brought up, volunteer, something that I was surprised to find out in our adult protective services, we have senior companion. Then our division of vocational rehabilitation are for folks who are disabled. And it's a training program. So people to come in and to learn vocational rehab skills and to help with job searches and learning about financial skills that they're needed to have a job and to keep a job. Anybody familiar with the Hawaii Youth Correctional Facility on the windward side? It used to have a census maybe 5 or 6 years ago, over 100 kids that were there. And a lot of attention that was given to it. And in the days since, we've really turned it around and recognized that the kids that were there were being put in there because maybe they were truant, maybe they were running away from unsafe situations. And the movement has really been towards juvenile justice and nurturing kids in the community. So I think the census is down to about 20 kids right now. Public Housing Authority, 302 employees, 6,200 public housing units. They're administratively attached, just like the Office of Youth Services. So they're independent, but we do the administrative stuff for them. We recognize that it's expensive to live in Hawaii. Affordable housing isn't necessarily what a lot of people think of affordable. Maybe San Diego, we're comparable, right? It's a big office of two who are doing dynamic things and setting policy related to women in the state. There's going to be next year, I think it's either the world or the national body are coming to Hawaii for their Congress meeting. And then finally, the Hawaii State Commission on Fatherhood. We can't have healthy families without recognizing the importance of fathers and father figures in families. And last thing that we added in the last couple years in DHS is the Limited English Proficiency Program. And this is something that we initiated, and it's really to be able to translate and provide access to folks who don't speak English or it's not their first language. And that's why I brought up the question, because you think about navigating through systems, right? Getting onto a web portal or calling for information. And if you're in a position where you're dealing with food, shelter, health, whatever it is, and you don't speak English. And I just wanted to list, because this was new to me, coming into DHS and recognizing that it's not just state, we're dealing with our federal oversight partners. So this is just a listing of some of the federal agencies that we work with and provide the federal funds for us. And as I've met with my counterparts around the country, it depends on what human services and departments are defined. Some of them just have child welfare services. So when you introduce yourself, I will always say, I'm Department of Human Services, Hawaii. We are state-run and we have Medicaid. And other people say, oh, I am, let's see, what's a good example? I'm Colorado. We are county administered and we don't have Medicaid and we're an umbrella organization. It's important to show that, look at how much we talk about how much we spend on healthcare in the United States, right? I can't remember, I want to say 16 trillion, but it continues to grow. And look at our life expectancy. If you look at the other countries who are spending less, but they're living longer, we're not on the right part of this graph. And we want to add Hawaii in there because Hawaii is going to be higher life expectancy and maybe a little less of the cost. So if you look at the ROI on our healthcare investment, you'll see the U.S. over here that we rank 11, right? And it's looking at the type of care we provide, access to care, efficiency, equity, healthy lives. But per capita, it ranks higher than all of these other. And then you look at health and social spending. So in this context of OECD, social spending is what we think of as human services, the social services we provide here. And so you can look at all of these different countries here that range from South America, North America, Europe, Asia, across the gamut. And I'm going to step across over here. You can see how much we spend in healthcare compared to all the other countries. Your zip code is more important than your genetic code in determining your health. So if we think about it, right, we grew up thinking the genes we inherited, right? Athletic parent or long-living grandparent, I got these good genes. But what research is showing and what we've known in public health is it's actually where you live and what are the determinants in your community that allow for your health and the health of the people in your community. So in Hawaii, we rank high in a lot of health outcomes, but it really depends on where you live. And we're here in Honolulu where we have access to a lot of things, right? But if you're living on the Big Island, there's a disparity in access to health care, in some of the other social determinants we're going to look at. So taking it back to life expectancy, women live longer, we know this. But if you compare by counties, right, it really makes a difference whether it's the Big Island or Honolulu County here, Kauai or Maui. We talked about the genetic factors before. This is who you're born as, right? It's going to determine how well you are and how well people in the community are. And then the lifestyle factors, right? This is what Department of Health does a lot of, and we do that with them. Social and community networks, right? It's who you have in your network, who's supporting you. But then look at this green line. These are the social determinants here when you're talking about egg and food production, right? Do you have access to fresh produce, and is it affordable, right? SNAP EBT cards. Education. Research has shown that for young parents with college degrees, it doubles their income over their whole lives. Right? So access to education, whether it's early intervention with child care or with preschool and early education early on. So it's education. Work environment, to be able to get jobs and to work in safe places and not spend your whole time on the road getting there. What we're learning is, to get from Kaka'ako to Royal School, it takes 5 transfers on buses for some kids. So then you wipe out this, right? And if parents are accompanying them, then how are they supposed to get jobs at the same time? Unemployment, having the opportunity, for livable wages. Water and sanitation, so environment. Healthcare services, having the access to be able to have quality healthcare services and affordable housing. So when we look at this, and people ask me, why DHS? It's because these are the levers that are going to improve our community's health, and most of this is DHS.
With our increasing disparity in income and the stresses on our state budget and social safety net, Hawaii has great challenges in human services, perhaps more than ever before, and we need well-qualified leadership to deal with these challenges. Rachel is well suited for the job, and we commend David Ige on this appointment.
Beyond that, Rachel represents a new generation of highly qualified and deeply committed public servants that can take us to new levels of leadership in state government. And we are delighted to have her in this office. Welcome aboard, Rachel, and good luck in this difficult and critical appointment. We need you, we're rooting for you, and we're counting on you.
And now let's take a look at our ThinkTech calendar of events going forward.
ThinkTech broadcasts its talk shows live on the internet from noon to 5 p.m. on weekday afternoons, and then we broadcast our earlier shows all night long. If you missed a show or you want to replay or share any show, they're all archived on demand on YouTube.
Visit thinktechhawaii.com for our weekly calendar and our live stream and YouTube links, or better yet, sign on to our email list and get the daily docket of our upcoming shows.
ThinkTech has a great new studio at Pioneer Plaza. We invite you to come down, see our studio, and be part of our live audience. Contact me, Jay at thinktechhawaii.com. Be a part of our civic engagement on ThinkTech.
Give us a thumbs up on YouTube or send us a tweet at ThinkTechHI. We want to know what you're thinking and how you feel about current issues and events affecting Hawaii. We want you to stay in touch with us, and we want to stay in touch with you. Let's think together.
On Thursday, September 17th, ThinkTech will join with the Anthology Marketing Group to present a program called Whither Thou Goest, Waikiki, Engine of Our State's Economy, at the Anthology Theater in Bishop Square.
The program will cover the status and prospects of the hospitality industry in Hawaii and will feature business, government, and academic experts on tourism in Hawaii.
Join us and raise your awareness about the critical changes taking place in our community. Be a part of the conversation and sign up to attend on thinktechhawaii.com. And now, here's this week's ThinkTech commentary.
I'm Donna Blanchard, and this is a ThinkTech commentary. I'd like to talk about approved government spying on civilians in France. Let's call it France's Patriot Act. France's Patriot Act has cleared the final hurdle now that the Constitutional Council has approved the legislation. The French government and intelligence is soon to have the power to use phone taps, set up hidden cameras and microphones, and conduct bulk analysis of metadata with almost no judicial oversight. Civil rights groups have argued ineffectively that the new legislation, which hasn't been updated since the advent of the widespread use of cell phones and the internet, claiming that the new law lacks sufficient checks and balances. That seems to be news to the French Parliament, which overwhelmingly approved the surveillance bill in May of this year, and it later sailed through the Senate following reaction to terrorist activity in and around Paris. In April, the French government uncovered an apparent plot to attack at least one church near Paris by a gunman who appeared to have been encouraged solely over the internet by handlers in Syria. The gunman never visited Syria, had no physical links to enlisting in a jihad, but it was determined that whereas this information was gathered more or less by fluke, it could have been intentionally gathered by means outlined in the new legislation. France has a large population that travels to Syria to wage jihad. Many of these individuals are lured, or at least communicate, with operatives in Syria via the internet. France's Constitutional Council struck down a couple of provisions of the law, but President Francois Hollande, who referred the legislation to the Council, stated that the rejection of those provisions did not threaten the overall balance of the law and would not prevent French intelligence services from protecting the country. Controversial provisions that have been allowed to sail through include the bulk analysis of internet metadata to track suspicious behavior, and the use in certain cases of so-called IMSI catchers, which capture all telephone, text message, and internet conversations in a given area. The United Nations Human Rights Committee has expressed concern about the legislation, saying that it grants French intelligence services excessively broad and intrusive powers without adequate and independent control mechanisms. Amnesty International calls it a major blow to human rights. So, why is it that the French appear to want to mimic America and Britain in allowing authorities to intercept and access people's communication at will? Because they're understandably afraid, and we've all learned. Our own Patriot Act, which was so broadly and understandably criticized, also helped our country protect us. That Patriot Act expired this year, and we quickly and rather handily enacted the new USA Freedom Act, which doesn't allow bulk collection of telephone records by the NSA, but does make records held by telephone companies available for broad searches by government officials with a court order. When ISIL is recruiting and directing electronically, don't we want impactful surveillance programs without government overreach? I know. To many of us, allowing the government to tap our phones sounds reprehensible, but I initially felt the same way about those X-rays you now have to go through at the airport. Pardon me, Edward Snowden, but in the grand scheme of things, I honestly don't think my contribution to the metadata, little bits and pieces of my cell phone conversations, emails, and underwire bra are so precious that I'm afraid to have that data collected to help fight terrorist activity in our world. I'm Donna Blanchard, and this has been a ThinkTech commentary. We'll be right back to wrap up this week's edition of ThinkTech, but first, we want to thank our underwriters.
Okay, Donna, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 like 7 times every week. Can't get enough of it, just like Donna does. For additional times, check out OC16.tv.
For lots more ThinkTech videos and for underwriting opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be a guest or volunteer, a producer or intern, and help us reach and have an impact on Hawaii.
Thanks so much for being part of our ThinkTech family and for supporting our open discussion of tech, energy, diversification, and globalism in Hawaii. You can watch this show throughout the week and tune in next Sunday evening for our next important weekly episode. I'm Jay Fidell.
I'm Donna Blanchard, and I will see you Tuesdays at 2 o'clock on Center Stage. Aloha, everyone.